Good morning, everyone, and thank you for joining us for the Alamo Together Remote Summit. I'm Dr. Ric Baser, President of Northwest Vista College, and I'm the current Incident Command Operations Chief. Today, we're here to talk about our plans for a safe and successful return to campus for fall. This morning, you'll hear from our board chair, Dr. Jean Sprague, our chancellor, Dr. Mike Flores, and Associate Vice Chancellor for Human Resources and Organizational Development, Linda Boyer-Owens. Toward the end of the summit, Dr. Flores and Ms. Boyer-Owens will answer as many questions as time permits. Thanks again for being here. Now, I would like to welcome Dr. Jean Sprague, Alamo College's District Board Chair.
Good morning and greetings on behalf of the Board of Trustees who are joining. They're joining us this morning to discuss the return to campus for fall. I know this is a topic that you are all interested in and concerned about. The board, I assure you, is as concerned and interested as you are. With us today, we have our Vice Chair, Dr. Yvonne Katz, our Board Secretary, Chris Kingsbury, our Assistant Secretary, Gloria Ray, Joe Alderetti Jr., Anna Bustamante, Dr. Lorraine Polito, Leslie Sahanovich, and Roberto Zarate, and our student trustee, Asia Leha. As board chair and representing the entire board, I can assure you that the board is justifiably proud of all the colleges and the DSO personnel that have made our Alamo Colleges district a success. This has been an amazingly successful year in spite of having to be shut down, going online. We maintained our numbers. We maintained our high quality of student success, even increasing our student success during this year. So congratulations to all of you. Together, we are innovative, student-centered, state and nationally recognized and highly respected as leaders among the community colleges. All of us on the board are looking forward to enjoying a safe return to campus for students, faculty, administration, and staff this fall. We want to congratulate all of you again who have helped us make it through this last year and will contribute to the success of our return this fall. Thank you.
Thank you, Dr. Sprague. And now please welcome our Chancellor, Dr. Mike Flores, who will give you an update on a return to campus plan for the fall of 2021.
All right, want to thank you, Rick, and want to thank Dr. Sprague and the trustees. I know, like many of you, it has been a long 17 months for all of us. And I think many of us were excitingly prepared for the start of a fall semester that would be able to provide sense of engagement, a sense of connection. Education, and in particular higher education, is a human enterprise. It is us being able to work together to connect with our colleagues, faculty, staff, being able to connect with each other, and most importantly, being able to connect with and support students. So I want to thank you for your service, your diligence, and your focus on student success for the last 17 months. And I also want to thank you for being prepared to pivot with us over the next few weeks, because I think that is really critical. Like many of you, I was looking forward to the beginning of classes. I was actually looking forward to Monday for a convocation in McAllister Auditorium, being able to shake hands and being able to greet everybody face-to-face within McAllister Auditorium, but that is going to be virtual. And I think that portends and foreshadows what it's going to look like for the kickoff for fall classes on Monday, August 23rd. So I wanted to briefly describe some of the changes that we're making. And I think, like many of you, the Delta variant in particular has had an impact with San Antonio and parts of our community, and also within Texas. So a few weeks ago, our community incidence rate was at about 4%, right? At about 4. And now it's a little over 20. We know the variant is a surge, so it will be with us just temporarily, like other peaks that we experienced with Delta. And we're fortunate that we do have the 17 past months, because we have lived experience and we know what works, and we know ways that can mitigate risk and ensure, as Dr. Baser opened with, the safety and success for all of us, staff, students, and community members. So there are a couple of things that went out in an email message to each of you yesterday, and were also messaged externally to the community for the benefit of our students concurrently. So a couple of things. One is that we will begin the fall semester on Monday, August 23rd, but those first 2 weeks will be largely virtual for most of our classes. Now, faculty, in conversation with their department chairs, there may be some courses, in fact, that will need to be conducted on campus and on site. Those may be workforce education programs, and those could be other programs. But we're leaving it up to, and we are reliant on faculty expertise and conversation with academic administration, Dr. Baser and his colleagues, to make that determination. Students will be informed that unless they have heard from their faculty member that they will be on site, they should assume that those classes will be virtual from August 23rd until September 6th, with normal operations resuming on Tuesday, September 7th. With that change, we are also going to extend level 2 until Monday, September 6th. So we will extend level 2 until Monday, September 6th, and then we will begin level 1 operations on September 7th. The other part, looking at what we know, is that we will have weekly screenings for COVID on beginning this coming Monday, August 16th. And the other is, I do want to encourage you, and Linda Boyers-Owens will talk about this, and she has a nice graphic behind her. I do want to encourage you to sign on to the Alamo pledge, the Alamo College's pledge, which encourage you to do the things that we've talked about in practice over the last 17 months, right? To be able to wear a mask, to be able to practice when necessary, some physical distancing, to wash our hands, screenings, all of those things that now we have those 17 months of lived experience and we know are very important. So I want to thank you, Rick. I want to thank, most importantly, each and every one of our 1,000 colleagues that are with us virtually, and all of those that have been involved in ensuring safety and success for everyone as part of the Alamo College's family. I know this in particular has been a trying time for all of us, having the sense that we would have, and actually having had probably a couple of months of being able to connect once again face-to-face with our colleagues and with students. And so all we're going to do is extend that a little bit. The other part is, I know that this is actually a peak time for many things. One is, professionally, we're prepared to welcome our colleagues, faculty, and to welcome current and prospective students to our campuses, but to the Alamo College's family. The other is, personally, many individuals are preparing or have sent or will be sending their kids to school as well. It's back to school not only for the Alamo College's family, but it's back to school for us within our household. So that is a stressful time for all of us. So I think what is most important is that we continue to work together, we continue to collaborate, and we continue to extend a little bit of grace to all of us within the Alamo College's family, and most importantly to our students. Will this perhaps cause a little bit of change in our pivot? Yes. Does that cause a little bit of stress? Most definitely it does. But if when we work together, what we've seen is the success of the entire college district family, for each of us to back each other up. And the other part is for our students to be successful. So I want to thank all of you for being here with us. And I know we're going to go to some questions and answers, and I'm going to turn it back over to you, Dr. Baser.
Thank you, Dr. Flores. Please welcome Linda Boyers-Owens, Associate Vice Chancellor for Human Resources and Organizational Development. She will be sharing with us about the Alamo College District Pledge.
Thank you, Rick, and Dr. Sprague and Dr. Flores. Excited to be here this morning and share with you the Alamo College's Better, Safer, Alamo Together pledge. I want to take just a couple of minutes so that you understand what the pledge is and how you can get in on it. We all know the situation's changing yet again. It's really hard for us. We were talking earlier this week about how messy it is every time we have to make these fast changes and how kind of unnerving it all is. This time it does feel like there's a lot that's not really under our personal control, a lot of variables and circumstances that we just can't change. But we always do have our personal power, and we can put our personal powers together and create collective power here at Alamo Colleges to create, an even healthier, safer environment for all of our students, all of our colleagues, and ourselves. I'm asking you in the coming week to take seriously consideration to take the pledge with me and your colleagues as we go into the fall. I know that some of you will be remote and some of you will be on site, and we have ways for you to all participate. We're calling this the Alamo Together Pledge because there's so much power in our ranks within the 5,000 of us who can make a difference for our Alamo Colleges community and for our community as a whole. So who can participate in the pledge? As I said, it's everybody. It's faculty, it's staff, it's administrators, it's also students and employees who are contractor workers, our housekeepers with Macklemore and other firms that have employees regularly and on site, and visitors. If they like what they see, we would certainly welcome them to participate also. As Dr. Flores said, I have the poster here. You'll be seeing these posters around campus, all over the college district with the pledge. We will post it also on Zoom today so you can see it. It's a 6-part pledge that really layers in multiple layers of protection and safety enhancement for all of us. As leaders, and we talk a lot about a leader in every seat, this is the kind of thing that we can do. We can step up together and model what great, safe behavior looks like. When you come on campus, starting next Monday, you'll see the posters at the health and safety screening stations. All the stations will have them. So you can see the pledge again. What you'll also find at the health and safety screening station are buttons. And those buttons are, flip my slide, I'm sorry. I'm not asking you to flip my slides. There you go, thank you. You can find a button. You can put it on, and that indicates you're taking your pledge. You're taking the dive here with us into a better, safer work environment. We hope that you will continue to wear your button so that your colleagues and your students will know that you're part of the pledge and you're practicing all the behaviors that make for a safe environment. If you are remote, you can still show your support that day by using one of the Zoom backgrounds that we'll provide that promotes also the Alamo Together pledge. Can you go to the next slide? So what about the 6 pieces of the pledge? We're going to ask that everyone consider masking up indoors. We know we can't require it, but we can sure ask you and encourage you to do that. If you are not that into doing it for yourself, please think about your most favorite employee who you know is worried and do it for them. The second part of the pledge is to give each other the space that you can. No matter where we are or what we're doing on campus, or I would say off campus also, spread out, take a step back, give people lots of room. That also creates a safer environment for avoiding spread of the virus. And finally, for the first 3 elements, keep practicing your good hand hygiene. We have lots and lots of hand sanitizer. If you need some, just say so. Your health risk coordinator will get it for you, or you can get it at the health and safety screening sites. Can you go to the next slide? Thank you. We're also got 3 more elements, the second 3 elements. We're going to ask every employee and every student and every contractor employee who is on site weekly to participate in the weekly COVID-19 screening. We've been doing this for a while. We've partnered with community labs. They are screening people all over San Antonio, and I think almost all of the school districts and colleges and universities. We are going to go to 100% screening in the coming weeks. We're going to give everybody a little time to get registered, figure out their QR codes, figure out where your screening sites are. We're still working with the colleges, I think as late as this morning, getting the perfect kind of schedule of days and times to offer screening, because we'll have to offer a lot more days and a lot more times at each location to get everyone through the screening process, because not everyone's on campus every day. So we will publish that schedule for you today or over the weekend as we finalize it. And we are going to be asking you to get registered and start participating. Can you go to the next, let's see, did I cover that one? I did cover everything. Sorry, I'm jumping back up. I'm sorry. One more, back up one. Sorry, there you go, okay. We're also going to really encourage you, if you haven't become vaccinated yet, to please consider doing that. We're seeing on the news how important that is. Some people were waiting to see if it was safe. Let me say that 68% of Alamo College's employees have registered on the voluntary registration site that they have become fully vaccinated. So that's a pretty good recommendation that people believe in it and it's safe. So we encourage you to go ahead and get your vaccine if you've been waiting. And also, very important, last element of the pledge is that you will please stay home if you're feeling unwell, if you're feeling sick, so that we stop the spread. Our health and safety screeners are stopping people every week who either feel sick or they have a fever. And some of those folks have actually had active cases of COVID. That's a way for us to create a safer environment. The same thing with the COVID-19 screening. We're catching cases that are asymptomatic. And so that also we can get those employees to quarantine and keep everybody else safe. So now let's go to that last slide, if you can, with the QR code on it. These QR codes are sort of, I know, they're a little bit mystifying, but they do actually work. And I actually did do this myself, and I made it work. The weekly COVID screening is a surveillance strategy. As I said, we're looking for asymptomatic cases. We're not asking you to come in if you think you're sick. We're asking you to come in and get screened because you don't think you're sick. And there is so much asymptomatic COVID floating around these days. And we want to catch those cases and get you off-site and away from everybody else. So we're going to ramp up to 100% participation. It's free. It's the rapid PCR test. You get your results overnight. You swab your own nose. It's super fast. It's painless. It gives you and your family a great peace of mind that you know you're not contagious with anything. When you do the QR, and I don't know if you can do it off this one or not. I did it off this one this morning, but all you have to do is hold your phone up to the QR code, and you will see this code on the walls all over the college district these days. But you can just hold your phone up, take a camera shot of that QR code. It will take you to a link with community labs. It's not an Alamo site, it's community labs. They're the laboratory that's doing all the screening testing. They will have you create a little account for yourself. And when you go to the screening station, then they will also have a QR code that they will send back to you that you show the lab tech. And the lab tech will read that with their phone. It's touchless. They hold up their phone, you hold up your phone. They read your QR code. They hand you the vial with your swab in it. You take it out. You swab tip of each nostril 5 times, and you put your swab in your test tube, and it's off. And by usually about 11 o'clock, 2 o'clock that next night, you have your results. If there are positives, your health and safety officers will be notified so that we can work with you to make sure that you're getting the care that you need and the testing that you need, and so that you're quarantined. And then we would, of course, do contact tracing for anyone who might have been around on site, close contact, and notify those folks and get them quarantined and taken care of also. So that's the process. We can answer more questions in of course, next week during publication, if you like, or during this session. So that's all I have. Thank you.
Well, thank you, Linda. And now Dr. Flores and Ms. Boyers-Owens will take questions. Due to time restraints, they may not be able to answer everyone's questions this morning, but we'll do our best to get back to you if they're not able to answer your questions today. Our moderator for this morning's Q&A session is Priscilla Camacho.
Thank you, Dr. Baser, and thank you, everyone. We definitely got questions, and so for ease to try to get things going, and I apologize, I should have said my introduction first. So I'm the Director of Government and Community Relations for the Alamo Colleges District, and so we've got a lot of questions. We're going to try to cover as much territory. Linda, I am going to ask that you move forward closer to your mic because we've had some audio issues. And so when we do get to you to answer some questions, just make sure to come closer to the mic. I know Mike Legg is also on the call, and he is going to also assist with any questions that you might have. But the area and the focus that I saw a lot of the questions about was testing and screening. So we put in our guidance that we are going to be requiring screening, and then we talked about the PCR test. And so I'm familiar with this. I went to the Texas Capitol on a regular basis, and we were required to do testing, and it was very easy. I'm not, it's one of those that you stick that little swab up your nose, and you do have the ability to get those results very quickly. Linda, let's kind of start with, again, kind of when you go on site, when we say screening, do we mean COVID testing? And then what does that include? And kind of walk through that process again, because we had a lot of questions about that piece.
Okay, yeah, I'm going to say we have 2 types of screening that's taking place now. We all know if you've been on site, you always go through the health and safety screening station. And that's where they take your temperature, they ask you if you have any symptoms, they give you your wristband, and you're good to go for the day on campus. In addition to that, all of the college locations and the DSO building at this point have a COVID screening location. That's COVID-19 screening. That's the PCR test. That's a lab test. That's the official name for it. And that screening location is manned by community labs, lab techs at designated times over the course of each week, so that employees, students, and contractor employees can go get screened for COVID. That's in addition to going and getting your wristband. What was the rest of the question there, Priscilla?
So one of the issues and the questions that's come up is that the QR code, and some phones don't register that well. And so is there an alternative way to be able to register with community labs?
Yes.
To go ahead and get that testing? And what is the process for that?
Absolutely. So if you see, this is what you'll see all over the place. I picked one up on my way in this morning. If the QR code doesn't work for you, there is a website, a community labs website that tells you where you can log on from your computer or your phone directly to register. If you have other issues with that, please email me and I will help you get registered. I'm very happy to do that for you. But yeah, we've sort of figured it out together, and we'll help you get registered. Worst case, if you don't get registered, please go to the screening station anyway, and we can register you right at the station. But we would prefer that you register ahead of time, so it doesn't slow down the process.
And
I was going to say, I know, so I have my band, right? So I come into the DSO office every day, and I get the health screening, right? So they check my temperature. They ask me if I have any of those symptoms. That occurs daily when I'm on site. The screening, right, that Linda's talking about is we're asking once a week. So that's on a weekly basis. Now, coming onto campus for the band, that's daily. The COVID screening is once a week. So just wanted to make that, because I saw a couple of questions related to that as well.
Thank you, Dr. Flores, because that was going to be my next question, was if it's going to be required for everybody that's on site to get that weekly testing to be able to be on site as required. And just want to reiterate that answer is yes, correct? Yes. Okay.
Yes, and that's exactly the schedule that the school districts are using. That's what UTSA is using. We're all doing weekly COVID-19 screening in addition to all our other safety screening protocols. Yes.
So one other question that came up, and I want to stay on testing because you've seen, I think you're looking at, there's been a lot of questions in that space, is with regards to if you utilize someone other than community labs or utilize a different type of those PCR tests that are now becoming more available at your local pharmacy store, and is that going to be allowable, and how do you submit that information to be able to come on site?
We have not set up any process to, and like I said, this is rolling out fast. This is a challenge to get our thousands of people screened. So we haven't set up alternate processes yet for people to send in results in other ways. At this point, we don't have anything like that. We may in the future, but our first goal with screening is to get as many people screened who are coming on campus as possible. That's our total focus, and a lot of the other bells and whistles we're just going to have to worry about as we wade into this with everyone.
And Linda, kind of piggybacking on your comment about trying to screen, and which includes the testing, as many people, everyone that's coming on site. We had some questions kind of at the tail end here that includes our students. So the students who are still going to need to come on site for their classes, because those have not been moved to virtual, they will also need to do the screening, including that testing. Is that correct?
That's correct. We're going to start with employees on Monday. So we'll be on campus a whole week. And then when students come to classes starting on the 23rd, those who do start on campus, we will begin to work with them to get them in the screening cycle also. Yes.
Excellent. So I'm going to pivot a little bit from testing to now these first 2 weeks and talking about the numbers, who is going to be on site and what that looks like. Because we had some questions about percentages, and are we talking about 50% capacity in the building? Or are we talking about the pods? So if somebody can kind of elaborate a little bit more of how that's going to work and what we're specifically saying to our faculty and staff, and then of course our students, when we're talking about what that means in terms of numbers and percentages.
So what we'd like to do, I think the overarching principle, right? So what are ways that and what are tools that we have in our toolbox to really be able to flatten the curve, right, of the Delta COVID variant right now? So one of the ways is what we've just discussed with being able to have the testing, being able to sign on to the pledge and use public health protocols that are very critical. The other part is as many of you know, we're a big place, right? We've got 5 colleges and 6 centers that enroll close to 70,000 students that we expect to come on to begin classes on August the 23rd. What we'd like to do is lower the number of students on campus and also lower the number of colleagues on campus to be able to do that. So we think that one of the most effective ways, obviously, because we're talking about out of our 70,000 students, we probably have about 50,000 of those that actually come onto a college campus. So if we can delay the vast majority of those 50,000 from coming on to a college campus or a regional center by 2 weeks, and we think that that will help us reach the top and then begin to flatten the curve for COVID right now within the community, because this is a surge. And we've had previous surges over the last 17 months. We had one last summer as well. So the intent is that we can assist both for Alamo, for staff and students, but also for the community to be able to flatten the curve. So that's why we're taking the action with a virtual start for fall 21. And then the plan is at this time, and we'll continue to monitor the situation. That was several of the questions that were in the Q&A, Priscilla, and colleagues will continue to monitor the situation. And if we need to extend beyond September 6th, then we can do that. But our hope is that we will be by that time on a downhill slide for COVID, and that we would begin to welcome larger numbers of students onto the college campuses. And so that is the part. The other part is extending level 2 to September 6th, meaning that we would have up to about 50% of our colleagues on campus also. On campus, within buildings, that we would do those types of things. For instance, I'm a DSO right now, and so we probably have about 200 folks that are within the building right now, right? Going through health screening, beginning on Monday, being able to have also not only the temperature check, but the screening for COVID with the nasal swab, and also where possible and when needed, wearing a mask. So these steps we think will allow us once again to plan to be together, hopefully as early as September 7th, welcoming students, continuing to engage with colleagues, all of those things that are important. So 50% staffing until September 6th. The other part is that most meetings will be conducted then virtual, right? So that just like convocation on Monday, just like today with over 1,000 folks tuned in, that we will be virtual also once again to lower and mitigate risk.
So piggybacking on, oh, it looks like maybe one of the mics. So piggybacking on what you just said, Dr. Flores, and kind of seeing some of the questions also with regards to CDC guidelines, our connection with, we've talked about working in collaboration and making sure there's alignment with our other partners like UTSA and the ISDs. And so there was some questions with regards to mask and the impact of the local health directive from Metro Health, along with the orders from the city and the county. And so if you can talk a little bit about that and where we are at and why strongly encouraging is where our direction is with regards to mask wearing on site.
Yes, so we are strongly encouraging colleagues, right, and students to mask when they are on campus. It's part of the Alamo pledge that Linda reviewed with everyone. We are not included right now in the temporary restraining order that exists within Bexar County for school districts and for city and county buildings, right? So it only applies to 3 areas: to school districts, to City of San Antonio, and Bexar County buildings proper. And we're not included in that restraining order at this time. The city and the county are going to court on Monday, I believe, Priscilla, right? And so they'll be able to argue that. Things could change on Monday, but at this time we are not included in the temporary restraining order. So it is strongly encouraged and recommended that that you mask up. But what's most important, right, is we know that there's a vaccine available that's readily available and that is free. And so the vaccination we know does work. Obviously, folks may have heard in social media, or they may have talked to someone and heard of what are called breakthrough cases, but we know the most effective measure, in addition to public health protocols like masking and washing your hands, is actually the vaccination. That individuals who are vaccinated are 8 times less likely, right, to have severe COVID symptoms, even with the Delta variant. So that's the information that we know at this time.
And so you talked about vaccinations, Dr. Flores, and we had some questions about this, and it may be you or Linda, but we did have some inquiries about if someone's already received the vaccination, how do they go on and register and report that to us so that it's in their files? Because I know we've talked about the benefits and
Yes.
that's outlined in our policy. So Linda, I don't know if you want to go through that a little bit.
Yes.
Yeah, can you hear me?
Yes.
Okay, great. Sorry, folks. Yes, if you go to ACES and you go to the employee tab, web services, there's all the options there for employees. The voluntary COVID registration site is right there, and you can log in and enter the fact that you have received your full vaccination. We pull that information off and then award those employees through HR. We award those employees either a personal leave day if they're full-time, or $50 in their paycheck if they're part-time or adjunct. So we really encourage you to do that. The information you'll see when you go to the site is not used for any other purpose. We're not releasing it to anyone. You've seen what we release, and that's just the aggregate numbers for the college district. And then by each college, we say what percent of the employees have registered, but that's as far as we go. So no personal information is released.
And staying on vaccinations, there were some questions about if there's any plans to have future vaccination pop-ups on any of our colleges or our training centers. And so I don't know who would like to address that question.
Yeah, so our hope is, obviously we had a very successful partnership with University Health System at St. Philip's College. I know that there was a pop-up clinic at Northeast Lakeview College. I know there's a pop-up clinic planned for Palo Alto College, and we'll begin to see more of that throughout the colleges and throughout the family. So that's very, very critical. And we know that also vaccinations are readily available, right, closer to home at pharmacies and at HEB and other places. So the intent is moving from those super sites like at Crossroads or Wonderland Mall and even the SPC clinic The thought is to bring it closer to everyone within their neighborhood. So we know the efficacy of the vaccine. In fact, at a seat at the table, we talked about that last month, both myself and Dr. Sprague, with one of our Palo Alto College students. We encourage you to do so. And if you would like to, as Linda mentioned, to be able then to self-report that if you'd like, and that we can get a sense of what that is and a profile. And we're close to overall amongst our colleagues, Priscilla, we're close to 60%, and that varies, as you know, in the COVID update, it varies by site. Here at DSO, we're actually at about 86%, and then the colleges are in the mid-50s to about the mid-60s. I think that probably the other part is most faculty will come back onto contract by Monday. And so if I know that they are from the questions, there are many faculty who are tuning in also with us today. Once again, we can put the link in the chat, and that way you all can go back to, and Linda just mentioned it, you can go back, and then if you choose to go ahead and self-declare that you've done so.
Wonderful. And so Dr. Flores, we've also gotten some questions, and I want to go back to earlier statements with regards to which courses were going to still remain coming on site, and how that was going to work at the colleges, working with the faculty. And there was some questions about that sort of process. And if somebody, a faculty or staff member, was having conversations because they themselves or someone in their family is immunocompromised, and what can they do to ensure that that issue or that concern that's being raised on them by them is being heard and taken into consideration as that we go through the process of determining whether or not they have to come on site. And so I don't know if you wanted to address a little bit of that, because we've got a couple of questions that have brought that up.
So what we thought was important is, so the next best step for us, right, was the email that you received yesterday, because faculty come on Monday. Staff are here every day, right? Working either on site or virtually. Faculty return on the 16th, on Monday, and then students are prepared for classes that start on the 23rd. So what we thought was very, very important is to message yesterday that we would have classes start virtually. The vast majority of classes would start virtually on Monday, the 23rd. So that went out in an email, and almost simultaneously that also went to the press, because there are two distinct audiences, right? Or three. There's all of us, and so that was the intent of the email. And then the other was to students and the broader community for them to know. But timing was critical for us to be able to do that. I think the other part is faculty. So the president's working with the vice presidents of academic success, working with the deans and department chairs. On Monday, beginning on Monday, that's when those conversations will be had. We are assuming that all classes will be virtual beginning Monday, the 23rd, right? Unless there is a conversation that occurs between the faculty member, the program director, or the chair and the dean, okay? So the students will be messaged that your classes are virtual unless you hear otherwise. The vast majority of those on-campus classes will be in workforce, in CTE or PTE, right? But there will be some additional exceptions, and that's based upon the efficacy of delivery, or it could be based upon the accreditor, right? There are a couple of programs that are accredited by the Federal Aviation Administration, and those actually during the last 17 months have largely been on site, utilizing public safety protocols. So I think that's what's critical. What I didn't mention in the beginning also, Priscilla, is that we, with the experience we have of the last 17 months, want to also be able to provide student-facing campus operations. So that is the Welcome Center, right? So students, if they do need assistance, can come onto campus and be able to do so. Students, as they come onto campus, are encouraged to abide by the Alamo Pledge, right? The other part is that could include academic advising, tutoring, the library, all of those what are deemed student support, student-facing services in student success, academic success, and campus operations. Campuses, all of the campuses are open. All of the campuses will continue, and DSO will continue to be open going forward, to be able to ensure that we can support each other and also support our students.
Thank you, Dr. Flores. And we keep getting a lot of questions, and so we're trying to go through, we're gonna probably take a few more, and then I did wanna let people know that, yes, you will get an email with a video, and we know that we did have some audio issues earlier, so you will see some of that transcribed so that you can get a full, the full picture of what was described earlier along with the PowerPoint. Additionally, some of this is going to be brought up again at convocation. So I want to assure those
Yes.
questions that have been brought that maybe we have not been able to address, we will address at convocation. Additionally, we will add some FAQs for some of the items that maybe if it's not clear enough in the guides and you want that FAQ, we will add that to our return to campus site. So please know that we are tracking, we are grabbing as much of the questions and consolidating them to try to address them now. But if something
Yes.
isn't addressed right now or comes up after this presentation, please be assured we will work to get those answers to you as quickly as possible. As Linda mentioned, all of this is happening in rapid time and real time. And as Dr. Flores mentioned, we have a pending court hearing on Monday that the city and the county are going to participate in. And so there's a lot of things in flux still as we continue to move forward. But I did want to talk a little bit and go into something that came up with regards to if someone tests positive when they come on site, then kind of process wise what happens. And then there was a kind of a sub question about tracing and contact tracing and how does that work, the interplay between us and then working with Metro Health.
Yeah, so if someone tests positive, or we learn they're positive for any reason, the risk coordinators and enterprise risk management work with that individual immediately to identify when were they on site, who were they with when they were on site, and we get the days. The days are very important. When and where do they think they were exposed, if they know, that's helpful also. And they then get with those individuals who were named as being in contact with the input from both parties. The risk coordinators can then determine whether that was really a close contact or not. And so this is where the importance of wearing your mask and, you know, distancing out from each other when you're together, it makes a big difference when you get into contact tracing, and how much time you spent together gets into, you know, whether you really have a close contact within Metro Health guidelines or not. So if you keep your contacts under 15 minutes, if you're wearing a mask and you're keeping a reasonable social distance from each other, you're not going to have a close contact, and you're not going to be really at much risk at all. But the risk coordinators sort through all of that, and they notify those employees then that did have close contact that they need to quarantine. They should be testing for their own health and safety, and for the health and safety of their family members. Keep that all flowing, and then Metro Health works with us to determine how long someone needs to be in quarantine based on, you know, all of those variables. It's kind of an individual determination, because there just are so many moving parts to each exposure. So keeping some reasonable distance from each other, wearing your mask, not, you know, spending more than 15 minutes together is really a big safety measure. If you're eating, eat outside if you can. A lot of the exposures that we see across the country are people are eating and you can't wear a mask, and if you're all huddled up around a table, that there's going to be opportunities for transmission. So just spread out.
So I'm looking at the time, and I think we might have time for 2 more questions. And so I want to go back to testing, and specifically, we got quite a few questions with regards to students and verifying that the student has tested when they come on site. And just to sort of reiterate this point, any faculty, staff, and student would need to show that verification the minute they're getting at that check-in station, correct, Linda? I think that's where they were trying to get consensus on, or trying to get clarity the students and how do we verify that the student has been tested.
So the intent, I think, as Linda mentioned, right, is to cast the largest possible net amongst our family of, 70,000 folks, our largest possible net, really those folks that are coming on to any one of our sites, whether it's a college campus, DSO, or a center, the largest possible net that we can cast for individuals to test, and that we will expend our efforts, right, our energy to cast that net as wide as possible and require individuals to test. That's what we're putting our focus on. Linda?
Yeah, it's a numbers game to start. And we all sort of get that. We're research based. We need to get our numbers way up. That's number one. Number two, we need to figure out right away who in that large number is positive and get them pulled out and off to the side quarantine so that we stop the spread. After we get that up and running, and it's a huge lift for all of us, then we can go back and kind of tighten that wide net by looking at, who's going through the screening process, who should be going through the screening process, marry those up, and then start looking at why aren't people getting through the process. Is it a schedule issue? Is it a location issue? Is it they don't know how to work the QR codes? There's going to be a lot of variables that we can work through with people. But no, we're not going to check a list or anything when you come on site to make sure you took your test. What we're going to watch is what are the positives and pull those out, because it's a massive number of people to kind of keep track of.
Thank you. So with that, I was going to turn it over, Dr. Flores, if you had any closing comments before turning it over to Dr. Baser, but I did want to emphasize that we didn't cover quite a few questions, and I know that there were some questions about the QR code. So Linda, you talked about that and sites. And so again, we'll send an email with this information. We'll send some links and some other information, but I'm going to turn it over to Dr. Flores for closing comments before then turning it over to Dr. Baser.
Sure. So I just want to thank everybody for all of their work. I want to thank the COVID task force that meets on a weekly basis. Dr. Baser, Dr. Garcia with Linda Boyers-Owens, with many people meet on a weekly basis to ensure that on our plans during the last 17 months, that we can continue to provide safety and success for all 5,000 of us and all close to 70,000 students, and be a good partner within our community. I think the other part is just what was contained in the communique or the email that you received yesterday at 4:45, right? That we are right now at level 2, and that we are going to extend level 2 to September 6th. That we will begin the fall semester on Monday, August 23rd, and we will start with most courses being virtual for the first 2 weeks, all the way until Labor Day, September 6th, Monday, September 6th, and that we will be at level 1. That's our plan at this time, right? That goes back to several of the questions, that we would be at level 1 then and resume, our hope is, and our plan is, normal operations then on Tuesday, September 7th. We've spent some time talking about the weekly screenings. We'll continue with the temperature checks with the health and safety officers at DSO, at the college campuses and the centers. and that we would have weekly COVID testing that is required just once a week, not every time you come on site, to be able to do that with the nasal swab, right? Which I think many of us probably during the last 17 months have become somewhat familiar with. And so the intent is to cast a wide net. That does apply for staff and students, and our hope is also for partners coming on site. And then we encourage you to sign on to the Alamo Pledge and to be able to do that. This is something that we've been monitoring, the Delta surge and the variant that has occurred over the last couple of weeks for us. We can look at other patterns that may exist in other states or in other countries. Those were questions posed, but there are different dynamics that apply. And so our hope is that our actions of other big organizations like UTSA, the city and the county, that those actions will reach a peak and we will begin to see a decline. And so that is our hope. Is this different than we anticipated? It is. Is this what we would have wanted? It definitely is not. But we've seen in the past 17 months that when we work together, we are able to withstand and we're able to move forward to support each other and to support our students. Are there many questions that may have been posed today, will be posed on Monday, that are still left unanswered? There are, but the general tenets are that we want to provide for the safety and security of everyone within the Alamo College's family. Our hope is that over the next few days, we will begin to answer as many questions that are posed. We encourage you to work with your supervisor. We encourage you, if you are at one of our colleges, to work with your college administration to be able to answer those questions that you have. We know that there's a little bit of gray area there and that you would like all of these, but we felt it was most important to message the intent and the start of the fall semester first, and that we would begin to fill that space and answer those questions over the next few hours, but definitely over the next few days. So thank you all for joining us. Thank you for being together and ensuring that we can support each other and our students. And Ric Baser, Dr. Baser, I turn it over to you.
Well, I'll thank everyone as well. Thank you all for taking the time to join us today. I hope you found today's summit informative, and I hope that you're looking forward, as I am, to seeing our students back on our campuses as soon as we can this fall. So to all of us, stay safe and be well.